Good morning everyone. Today we are going to conduct a session on anti-hepatitis drugs. It is a part of antiviral agents. It is a very short topic, so let's continue. We will discuss the pharmacology of the drugs. Introduction. Anti-hepatitis drugs are the medication specifically designed to treat infections caused by hepatitis viruses. These drugs target the hepatitis viruses, aiming to inhibit their replication and reduce the severity of the infection. There are different types of hepatitis viruses, including hepatitis B virus, HBV, and hepatitis C virus, HCV. And specific anti-hepatitis drugs are developed to address each type. Hepatitis B virus, HBV, is a type of DNA virus that, similarly to retrovirus, can integrate itself into the host chromosomal DNA to create a lasting infection. In contrast, hepatitis C virus, HCV, is an RNA virus that does not integrate into the chromosomal DNA, resulting in a non-curable infection. However, it often leads to chronic hepatitis. Certain antiviral medications such as ribavirin and Interferon-alpha, commonly used for hepatitis virus, lack specificity and inhibit other various viruses, including both RNA and DNA types. When we see the classification, there are drugs for hepatitis B and for hepatitis C. The drugs for hepatitis B include lamivudine, Entecavir, Adifovir, dipivoxil, Tenofovir, and telvivudine. And the drugs for hepatitis C include ribavirin, Interferon-alpha, Sofosbuvir, Simiprevir, Daclatasvir, Ledipasvir, and Velpatasvir. Okay, so let's now discuss anti-hepatitis B drugs. The hepatitis B viruses cannot be eradicated from the body. The treatment is aimed at suppression of the virus and its inflammatory and hepatocytes damaging response. This results in improved liver function and reduction of risk for development of cirrhosis and hepatic carcinomas. Sudden stoppage of anti-HBV drugs can result in acute exacerbation of hepatitis. Many experts believe that unless there are issues such as decrease in effectiveness or concerns about toxicity, the use of nucleoside or nucleotide anti-hepatitis B viruses drugs should be extended until 6 months after seroconversion. Combination therapy of hepatitis B virus has not proven superior, and drugs are generally used sequentially. Entecavir is an anti-hepatitis B drug. This newer guanosine nucleoside analog is currently the most active and first-line option for treating chronic hepatitis B. Like other nucleoside analogues, Entecavir inhibits hepatitis B virus DNA polymerase after activation by intracellular phosphorylation. It brings down HBV titer most rapidly and more profoundly than lamivudine, and this is attended by clinical, biomechanical, and histological improvement. The response is well sustained, and HBV resistance to Entecavir is rare up to 5 years of use, but is more likely in case already resistant to lamivudine. It has weak anti-HIV activity as well. Adifovir dipovoxil. Adifovir is a monophosphate analog of adenosine monophosphate that is active against HBV and some other DNA as well as RNA viruses, but is used only for hepatitis caused by HBV. Esterases in the intestine and liver release the active drug during absorption to attain oral bioavailability of approximately 60% in the terms of Adifovir. On entering cells, Adifovir is phosphorylated to the diphosphate, which has high affinity for hepatitis B virus DNA polymerase compared to host cell DNA polymerase. Adifovir itself gets incorporated into the viral DNA, resulting in termination of the DNA chain. It is primarily excreted by the kidney. While Adifovir plasma half-life is 7 hours, intracellular half-life of its diphosphate is up to 18 hours. Tenofovir disoproxil fumarate (TDF). It is a monophosphate nucleotide related to AMP, which is active against hepatitis B virus as well as HIV. Due to very low oral absorption, it is used as the disoproxil ester prodrug, which not only improves bioavailability but also intercellular passage of the active form. Tenofovir released from hydrolysis of the prodrug is diphosphorylated by cellular kinases into tenofovir diphosphate, which preferentially inhibits hepatitis B virus DNA polymerase and HIV reverse transcriptase. Affinity for host DNA polymerase is very low. It is also get incorporated into the viral DNA to cause chain termination. Tenofovir disoproxil is incompletely but adequately absorbed after oral intake and is largely excreted by the kidney with a plasma half-life of approximately 16 hours. It produces few side effects which are mostly limited to GI tract, that is nausea, flatulence, abdominal discomfort, loose motions and headache. Slight increase in serum creatine is common, and acute renal injury or chronic renal disease is possible. Drug interactions are not significant. It is administered in a dose of 300 mg daily. So now let's discuss anti-hepatitis C drugs. The treatment is directed to suppress the virus. Drugs are expensive. They include ribavirin that inhibits RNA synthesis, Sofosbuvir that inhibits viral RNA polymerase, Interferon that inhibits viral protein synthesis, Daclatasvir and Ledipasvir that inhibits HCV replication. Interferons. Interferons are proteins produced by virus-infected cells and also by recombinant DNA technology. There are mainly three types of interferons, namely alpha, beta and gamma. Antiviral activity of interferons is due to the inhibition of viral penetration, synthesis of mRNA, translation of viral proteins, assembly of viral particles and their release. They are administered by intramuscular and subcutaneous routes or locally into the lesion. Uses. Interferon-alpha is used for the treatment of venereal warts, herpetic infections in immunosuppressed individuals, chronic hepatitis B and C, and Kaposi sarcoma in HIV patients. Adverse effects of interferon include fever, headache, myalgia, skin rashes, alopecia, bone marrow suppression, cardiotoxicity, neurotoxicity, and thyroid dysfunction. Ribavirin. It is a synthetic purine nucleoside analog that has a wide range of antiviral activity. Ribavirin monophosphate competitively inhibits cellular enzymes that are needed for synthesis of guanosine triphosphate and nucleic acid. Ribavirin triphosphate also competitively inhibits the viral mRNA synthesis. It is administered by oral, aerosol or intravenous route. It is metabolized in liver and excreted in urine. Ribavirin is effective against a wide range of RNA and DNA viruses. It is used to treat influenza, parainfluenza, measles, adenovirus, respiratory syncytial viral infections. Oral ribavirin is effective in the treatment of chronic hepatitis C infection. Adverse effects. These include nausea, tiredness, cough, dyspnea, anemia, and insomnia. Conjunctival and respiratory irritation may occur on aerosol therapy. Ribavirin is contraindicated in pregnancy and childbearing age group because of its teratogenic, mutagenic, embryotoxic and gonadotoxic effects. With this, we conclude our session. Thank you for listening. I hope you understood it, and if you liked it, please share it with your friends and spread knowledge. Thank you.